All right, we're live.
All right, guys, we are on to patient number 2. So I just started on the lips. It's super important to me that we communicate what we do and don't want, and everyone's look is different. The idea of what beauty is now versus classic beauty has changed. Our proportions have shifted a little bit. And just like anything, there's trends in fashion, there's trends in beauty. So we started injecting just a tiny little bit on the lip. Put your head back for me. So far I've injected just a touch up here. She's got, I'm going to point with my needle so don't move around, but she's got these little gaps kind of right in the middle and off to the sides of her upper lip. I just want to soften those so there's not much deviation through her shape, and then a little bit of enlargement. Not a ton of size on top, and then we're just going to go for a little bit of pouty volume on the bottom, and that's it. So I want to make sure that she was comfortable with the shape and size, so we have the one side done. And it was only 0.1. So when you're trying to fix or even out shape, a lot of times you don't need a lot of products. So patients tend to be worried about how much is used. It's not much. So that was 0.1. I'm going to move over to the other side. We'll do a couple pokes and take a breather because lips do hurt no matter what. So even with good numbing. First poke. Good. Deep breath. So I'm just injecting a really small amount of filler. She doesn't need height in her lips. Next poke. Good. Oh. You okay right there? Okay. Almost done here. Okay, take it. Oh. Let me wipe you. Lips are funny because the nerves are all connected. Nerves, nose, eyes, mouth, nerves, nose, eyes, mouth. Yeah, so they are all connected. So even if you're injecting the lips, your eyes are going to water. Sometimes you're going to have to sneeze. It's just a trigger effect.
Let's just work on the bottom. I don't want any more on the top.
Okay. So we'll go on to the bottom here. A couple clicks on the bottom. Okay, different style. Oh. Good. Keep breathing. Close.
Everyone has a little bit of pain when they get injections. That's why we numb.
Close. We're flipping it out.
I just waved back.
I know. We would love for you to come get your jaw contoured. Come in anytime, Reckless.
Stop shaking. Dr. Emer, what's your take on doing nerve blocks for lips?
I don't like doing them because I think it alters the lip shape by doing the nerve blocks. A lot of people do it. But they do, when they do it, they do the same lip for every person. So it doesn't matter. When you're customizing, I really don't like to do as much in terms of nerve blocks, and just do the best you can with icing and deep breaths and meditation. But I do think it changes the lip.
I agree. I'm going to come to that side and do a little bit more on the bottom.
So she's more sensitive. She's a sensitive girl.
Okay.
Well, to this.
Okay. Don't worry, I don't think any ex-boyfriends will be calling us. Now, why did you choose velour for her?
So I wanted something that had volume but was still soft and not too much. She wanted to have the volume that she wanted, but without looking like they were pouty or overdone. Not that they would look overdone with a stronger filler, but some fillers just draw more water and they give you that full pout, and others don't. Let me clean you and take a peek. You can tell me if you want more size. Okay. When you've had a patient for a long time, they definitely know what they like and they verbalize it. You know exactly what they're looking for.
Yeah, I like it.
you want to keep going with the lip or you want to go to your under eyes?
Yeah, I mean, what do you think?
I think you could do a little bit more balancing.
On the top?
One more poke on top,
Okay.
and then one more poke down here.
You can do the one down there first.
Okay.
The top hurts.
And top does hurt.
Mm-hmm.
Open. Guys, are there any questions right now about filler or lip injections or anything like that?
Not yet. Someone said your work is amazing.
Thank you. Open, open, close. Just relax. Last little, actually I'll just do a gentle poke on top.
That's not bad at all.
Yeah, the border is always more sensitive.
Non-surgical nose jobs last typically about 6 months to a year. But after about 2 or 4 weeks, you guys, it takes a little bit extra typically, a little bit more than just the syringe, usually the little touch-ups. Now the filler she's getting done today would typically also last up to a year, but often when you have chiseling and contouring, at about 3 to 6 months you notice it going down a little bit, and people do little tweaks here or there. That was good.
Yeah, that's really good.
Okay. So let's think on that. If you want to do more, we can always add to it. Okay. By then, the numbing will set in too.
So again, remember, you're a very thin, athletic female, tight jawline, high cheekbone. In this instance, you could bring the chin forward a little bit to balance her along. Her nose is very straight, but now we see there's a little bit of hollowing here and in her under eye, this whole OG area. She has a high cheekbone, but hollowing here and here. So some filler in those areas will really balance everything out.
You want to jump
Can we do
into
temple?
that?
Yeah, we'll start from the top down. So temple is really easy, it just feels weird. So for her, we actually want to go a little bit lower, a little pinch, deep breath. And we're gonna go right to the bone. And we're just going to nice and slow. Now, she probably needs more than one syringe here, but what we're gonna do is just do a little bit to start so she gets used to it and feels comfortable. We're going underneath all the blood vessels, so that's a very safe area. And we're using Juvederm, which will hold a little bit of water as well to give us some substance in this area. Now we're gonna go one more little poke right up in the middle here, a little bit higher, right again onto the bone there. We're just doing a soft, very soft injection, and this will support her brow as she ages too. She doesn't really have sagging right now, but you never know what happens in the future, so we want to be preventative. Okay, good. So now we're gonna switch. So like, look at that, you guys already. Look at the difference in the one side. Just that small amount already made a nice difference. We're still gonna want to put some a little higher, a little lower eventually, but at least start with some. Perfect.
Sorry guys, I'm gonna put my hand right there for her vessels.
And now we'll blend her cheek a lot more. Now, do you have extra of that velour over there?
I
Just use that on
do.
her chin.
What filler do you recommend for the tear trough?
We're gonna do that in a second, right? We're doing tear troughs?
Give me a second. We are gonna do
Yeah.
tear trough.
They're gonna do tear troughs in a second. Of the Juvederm family, I like usually Volvella. In that area, if you're doing the cheek fat pad and lifting to kind of fill the trough, you could do Voluma or Juvederm Ultra Plus or even Juvederm in those areas. I typically don't like straight Juvederm directly to the under eye because it holds a little bit of water. But the newer Vicross technology fillers like Velour and Volbella do amazing. They're really soft, have very minimal swelling. Some people even pre-hydrate them. They'll add a little bit of water to them and let them sit for a short time period and then inject them so the swelling goes significantly down. And you can see where she's working her way all the way up there. Was that really bad in the temple area?
No, not at all.
Just
Yeah, it's
sounds
not
funny.
bad.
No.
Do you trust me on your chin?
I do.
Okay. I'm gonna do 2 pokes in there. because it's gonna blend. So with her, you guys look, if we look at this angle here, we draw a line from here to the corner, right to the middle. You wanna keep her chin very narrow, actually. So all we need to do, if you look from the side, now that her lips elongated, is just literally project. You can feel, now one thing that would benefit her a lot is Botox on her chin, actually. And that's an off-label use. Her muscle here is very hyperactive. You can see the reason we know that's the case is there's a little bit of kind of cobblestoning. We call like kind of like a soft texture. You're gonna feel one more pinch after this, okay?
Mine does that too.
And what that will do if you do Botox there, it will not only soften the look, but it'll drop the chin muscle so that the filler can project more forward. Sorry, honey. Perfect. Yeah, that's gonna do really good right there. And so what would happen is this muscle right here is really strong, so it would drop it down a little bit and it'd make her chin, her jawline and chin look more elongated.
Everyone's saying how great you look.
Yeah, that's great. So that you'll see, it's gonna make a huge difference for you.
Oh, wow, okay.
What do you guys think? Big
Really
difference,
good,
right?
yeah.
I'm so nervous.
All right, so now you're gonna do, Danielle's gonna use a cannula, guys. We're gonna do cannula because we wanna prevent bruising, and she has a very deep set trough, so by using the cannula, you can go a little higher without any risk. Much less risk.
I'm just gonna measure first. Just look up to the ceiling, just with your eyes.
Oh, she's
Don't
deep.
mind my
She's
cannula.
deep. I'm gonna inject one spot in her temple. You're gonna feel a second injection quite at the same time. I use this a little bit. And Danielle left.
Okay, pause for a second.
I'm excited to see the temples.
Little poke here.
Love it.
How long have we been talking about temples?
Honestly, forever.
Honestly.
Really?
Yeah.
All right, happy birthday. When's your birthday?
Actually, next
Oh, perfect. That was
I know.
your pre-birthday present.
Thank you.
Okay, so cannula, we make one starting point. You shouldn't feel much pain at this point. Just funny feeling. You'll feel me moving. You might hear it or kind of feel some of the pushing, but it definitely shouldn't be painful. Can you open your eyes? When did these lashes get so long?
Girl.
Use the tease?
No, I use actually like that Rodan and Field stuff.
Oh yeah. Cool.
Open your eyes a second. Look up.
And by using the cannula, you guys, there's no needle poke, so it's much less of a pain
Hear it. You
and
shouldn't really
risk.
feel anything.
Now tell them the filler you're using and why.
Okay, so I'm using Volbella. It's the thinnest of this family of fillers. Very minimal swelling, if any, and it's soft. She doesn't need a lot. She's super thin, like you had said, and we've been building up volume here for a while now. Open your eyes and look up again. Thank you. And so we've been building that up, and now we're just fine tuning a little bit.
Now in some people, the tear drop actually extends all the way laterally to the edge of the orbit right here. And as people age, what? What'd you say?
It's light.
Oh, it's okay. I know it's so hot. As people age, they get a little indentation here, just like a hip dip. You can get it on the eye, so you get a little loss of volume here. So sometimes it's actually good to treat the trough and extend the filler up through here and into the orbit, so you can get a little lifting here and support into the cheek. And then you don't look as sort of aged, or hollow as you age.
So my cannula's way up here, guys.
You gotta say, guys.
Guys, Volbella.
Yeah, exactly. We need to do a shirt that has like
You
this.
can literally
It
watch
says,
it
hey
film.
guys, and it'll be Danielle and me.
We both do it.
I know. So you guys see already, look straight ahead for a second so they can see.
Let me blend this.
Like just open your eyes,
tiny
open your eyes. Look straight. And you can see you guys
bit. Chin down.
filled, not filled.
Okay, open your eyes. There you go.
Chin makes a huge difference. I think. Yours looks great.
Yeah,
Oh my
I really
God.
like it.
So good.
Excited.
Yeah, looks good.
That makes sense.
It's just so crazy, those little tweaks.
Yeah, and you don't
You know how I am.
think about that kind of stuff until you tune it out, and then
Okay,
you're
open
like,
your eyes
It's
fully.
hard because I'm not a
Okay, perfect.
younger person.
It's
Like, I
funny
don't
when your
tell you
eyes
you
start,
need
like the
this,
eye muscles
but if
start
someone's
feeling
in
numb.
there-
Yeah,
I feel
I
like
do.
I feel like I can't open my eyes fully, you know.
Look, this is what's gonna make it look better.
So,
yeah.
okay, two
Not that you
things.
need
For one, low
it,
poke.
it's just gonna
Mm.
improve
I guess
it.
three things
Right.
now.
Cause now,
so
you do have
with
to look at bigger
filler,
lip for the way your face
We
is
use
shaped. It's just
really
naturally
good
the
strong
way it
topical
is.
numbing. Go
More
ahead and pull
natural,
that.
a little bit more
So your
volume.
topical
So
numbing
that's
spreads,
really
especially like
Yeah.
right now we have the lights
Just occur.
on, it's definitely warm, you're gonna feel the movement. The topical numbing spreads and around the eyes, you numb so well. So under eye fillers is something that people tend to be super nervous about and they shouldn't be.
What does a cannula feel like?
Does that hurt?
It feels like a lot of pressure, but
But not a lot of pain.
not pain,
Good.
but pressure.
When I had cannula under my eyes, I honestly didn't even feel it. I barely felt it moving. It just depends. And also it depends. Look up for me.
You can feel it a little more on the bone if you're on the bone.
I think it just depends too, like if you're more at a more sensitive time period and things like that. Would you like this area or this filler for under eyes, especially someone where we filled in the hollow and now we just want to fine tune the small little ridges? It just needs to be soft.
Here's the key, you guys, and I'm gonna be honest. If you look at the clinical data, Vicross technology fillers have the tendency to want to inflame sometimes a little bit later. So the key is you do small amounts, and I like it better because then you can see it and build over time, and it looks really good for a longer period of time. So you notice she's doing the syringe in the eye, but she's using like half a syringe. She's not doing a huge amount. You don't need a lot of the Vicross technology fillers like Volbella, Voluma, Velour to get a really nice improvement. That goes a long way. And that's why we like it,
To the ceiling.
okay? And it's also soft and a little bit more subtle. In the small amounts, you know, it looks really nice.
So I definitely want patients to move around as I'm injecting them, make expressions, see how their face changes. Some products move around really well with facial movement, and others are more rigid and good for building up structure. So that plays a big role in how we choose. Last little spot here. But with these fillers, they now pretty much all have numbing inside the actual filler,
You can feel it.
and you feel it. So when we're numbing from the inside, her lashes are feeling funny. So when she
Yeah.
blinks, she's feeling something different than she's felt every other day of her life. So it is a strange sensation, but
Tell
it's
them what you're doing
totally
here.
normal.
This is important.
This is important. Okay, so a lot of people inject under eyes and they forget this lateral ridge. Also, for patients who like to have their cheeks done, you need to blend this, make it a smooth transition from an elevated cheekbone to the actual ridge of the orbit. So a lot of people neglect it. It's a pretty telltale sign. It bugs us.
That was me, for sure.
So we
I get
put
very
filler right
frustrated.
here to support the side of the eye to smoothen out the transition between trough and cheekbone.
And that's understanding anatomy. I call that anatomical filling or dimensional contouring. You're doing it in 3 dimension or a different shaping so that it's blended. It's not just a chisel. You know, it actually looks more natural.
Janice, she said she wishes she was here. Janice.
We would love for you to be here. Come anytime. We think it would be great. Could be one of our next in our filler roulette.
Last little tiny bit.
That'd be
Yeah, this
fun.
is like our new favorite game.
Yep.
Okay.
You got
There's
it?
10.
So now we're gonna do filler roulette, early birthday present. So early birthday
Yay.
present, you guys. Okay, last part. This is gonna be the cherry on top because we did a nice blending. If you take a look, lay back just a teeny bit, I wanna show people. We have a nice angle here, but she's, the type of face she has, mid-face is a little bit more flat. So to make this where it doesn't feel like it's more, everything's sort of downturned, if you turn to the side, we give a little definition on the jawline. So what we're gonna do, not a lot of filler, very little. She doesn't need much. We're just gonna come back on the edge of the jaw and just do some very fine, subtle threads, just to give her a little definition here, because then it gives her like she has more of an angle to her face. And we're gonna use Juvederm again. She's doing great. Now, not gonna do a lot, just a subtle amount. This will also make it so it doesn't feel like she's as sort of hollow. She'll be a little more lifted in this back area. Look up for a second. Yeah, right there. Perfect.
What gauge cannula do you use?
Well, she just used a 27 gauge, which is really good for the under eye. Here we're doing a needle. Okay, so now look straight for a second. Look up for a second. Turn a little bit this way. Perfect. So now you can see the 90-degree angle is much more defined. Even like a little bit more right there would be good. Just a little. Okay, so now let's go to the other side. Do you want to do it?
No, go ahead.
Okay. You can see from the front? Very good. Okay. Turn now this way. So we're going to show you this 90-degree angle. And again, we're going to go right back to the edge of the jaw. Just do little threads. Very subtle amount. Give a little bit of structure at this 90-degree angle. And this will give her face a more structured, kind of contoured look. She's super slim, but it also will balance what she had done in her middle face and chin. Okay, so now let's show her the final result.
Let's wipe you off a little bit.
Bleeding everywhere.
No, actually.
Oh wow. Yeah, there's so much of a difference there.
What do you think?
I love it.
Isn't that nice?
Yeah.
Yeah, so we have now lifting and softening through the eye and cheek, balancing with the temple, and now a little bit right here,
Yeah.
just to give that, chisel effect. The chin, now look from the side. See how the chin comes forward a little bit more?
Yeah, it's so subtle though. It's
Right.
like, yeah.
But it balances, and then it matches the lips. So it's perfect.
Yeah. Thank
Like
you
it?
so much. Yeah.
Happy early birthday.